Good afternoon, everybody, and welcome to this re-recording of the Communities of Practice WebEx. Unfortunately, we had some technical difficulties this morning, but I'm going to be going through the presentation again. So hopefully you can see on your screen the first slide, which is connecting people to best practice, communities of practice. So if you remember from the idea of these WebExes, knowledge management, is that we'll be explaining what is in the knowledge management toolkit, and one of the tools is communities of practice, and this is under the heading of connecting people to best practice. So that's the first slide. Okay, so we've now moved on to the second slide, which is showing the NHS postcard, which has been created for communities of practice. So the first slide that you can see there has a definition of communities of practice, which is from Etienne Wenger. So it says communities of practice are groups of people who share a concern, a set of problems, or a passion about a topic, and who are deepening their knowledge and expertise by interacting on an ongoing basis. So this explains how perhaps communities of practice is different to, say, networks or other groups that you might have, that it's going to be sharing a concern rather than perhaps all in the same position in a job. So, for example, we might have a network of library managers, but that isn't necessarily a community of practice. We could have people from across the range of library workers who are trying to look into a certain problem or looking at a certain topic, and they could be across the different grades, across the different professions, but they come together as a community of practice. So it's a network of people perhaps in similar roles, but also who share an expertise to connect them together. And it also says about connecting them in person or virtually, so we are going to talk about that later on, how communities of practice can be set up. Okay, so our third slide is the other side of the postcard. When we've done previous WebExes, we've talked a lot about how to facilitate, so for example, the peer assist. We talked a lot about how to facilitate a peer assist, and there was a lot of information on the postcard to help you to do that. With communities of practice, it's a lot more flexible and less rigid. So as you can see, it says collaboration anytime, any place. So a community of practice can come out of any sort of meeting or group. It could happen any time of the year, or there's no fixed time. It could last for years. It could last a few months. So there is no rigidity to how long these communities of practice can last. So it says making use of networks and communities of practice around key business processes and subject areas to link people across the NHS and beyond, so that knowledge is shared and reused widely. Okay, so our next slide, this is information that's taken from a paper that is on the Knowledge for Healthcare blog, linked to knowledge management, and it came out of National Voices. So they looked at three ways in which a community of practice is made up. So the first they have labelled as domain. So that's the shared focus of the community. So as I just said, you might have a network of people who are all library managers, but that doesn't necessarily make them a domain for a community of practice. You could have lots of people working across libraries at different levels who are trying to solve a particular problem, or who have an interest in, say, for example, how the library can get involved in the world of apps. And they will be a mixture of grades and of specialities, but they are coming together to create a community of practice around apps or around another interest. That's talking from the library point of view, but also, of course, the bigger picture is that we want to build a community which is multidisciplinary. So, for example, if you're thinking across your own NHS trust, you're going to have clinical and non-clinical staff. You're then going to have clinical staff from different disciplines, and non-clinical staff from different disciplines. So if you think of the wider community, that can also come together. So you may have lots of people who are interested in cannulation, for example. You're going to get lots of different groups of people who do cannulation and who want to talk about changing the way it's done or finding out the latest research on that particular subject. So that will be a multidisciplinary community of practice. And then the final point that was made about is the word practice, which is having high levels of trust between everybody within the community, which enables the sharing of tacit knowledge. So that's people who've had personal experience. So you could, for example, look at a trust that has used a particular model of training nurses, and those people have been successful or maybe unsuccessful, and they have come to visit your trust and talk to you about how you can implement that model, but you might then want to set up a community of practice to let other people know about that model, and it's a more practical how we overcame these problems or how we made this work, why this didn't work for us. So it's much more of a practical approach rather than a theoretical approach. Okay, so the National Voices, which I just mentioned, is a community of practice in the health and social care community. So it was lots of health and social care charities got together. It is quite a long paper, and it does get later on about very specific to their health and social care charity work. But it does have a couple of pages at the beginning about what a community of practice is and how to facilitate one, which is quite interesting. So when we send the presentation out or when it's on the blog, you'll be able to click on the icon, the National Voices icon, and then have a look at that paper. Okay, so when we were able to do this WebEx Live this morning, we had an interactive exercise. So as I said, I'm re-recording due to technical difficulties. So what I'm going to do is show you the question that we asked people this morning, and then the following slide is the answers that they gave us, and I can talk through the answers a little bit more as well. So our interactive exercise was, where can you see opportunities for communities of practice to be facilitated in your organisation? So this is trying to get people to think across their trust, their organisation, as to how they could bring people together to create a community of practice. So we had lots of very good answers from things that we've been thinking about here in Exeter, to have a leadership community of practice, keeping perhaps all the associate practitioners together in a community. You might get newly qualified staff who might be in different disciplines, but they have a common issue around getting used to the trust. There's something that they all need to learn. You've got the TEL community as well, research and development, and clinical skills, which I mentioned before. So something like cannulation, which a lot of groups of staff do. They may be looking at changing it, and that's going to affect a lot of clinical staff rather than just, let's say, the nurses or the doctors or junior doctors. So it's really thinking across the spectrum, across the board. Okay, so we've talked about what a community of practice is, how it's perhaps slightly different to a networking or a group like that, which we're probably all used to being involved in. How can library and knowledge services help to support communities of practice, and where can you see how you can help people out with the community of practice and how it's different to just networking and meetings, etc. So this is, again, taking from the National Voices document. So we've got points like facilitation. So it's us as library and knowledge service staff having that idea of facilitation, hearing that certain groups are all struggling with one particular thing and bringing them together, or bringing ourselves together as library staff when we know that there's a particular point that everyone is struggling with. So it's that idea of facilitation, which we're quite familiar with, facilitating things. Also a safe space. So again, this kind of goes back to the idea of libraries coming in and asking questions which people may not feel comfortable with asking somewhere else. So they are coming into the library and seeing the library staff as a safe space to ask those questions when perhaps they don't feel comfortable within their own clinical or non-clinical environment. Cutting across boundaries. Obviously, library staff have contact with lots of different areas of their trust or out in the community or charities. So we can cut across boundaries. We're not tied to our own, perhaps, clinical area. We can look outside an area and look across the whole spectrum of staff, which puts us in an ideal position to aid creative problem solving and to act as a vehicle for change. And we also have the tools and the skills to keep that interaction going. So you may have a wonderful first meeting with lots of people, but it's keeping that interaction going and that contact between people. And we have a lot of tools that we can use and the skills to keep people in contact after the initial flurry of interest. Okay, so speaking about methods of communication, obviously, hopefully, we are, with knowledge management, looking at ways to increase the flow of evidence and knowledge around, first of all, our own trust, but then the NHS in general and our wider community. So I asked the question as to what methods of communication you could use within a community of practice, and this was going back to what I just said about many networks start off with a big flourish and lots of people are very keen, but when they go away into their own geographical area or perhaps they're a bit remote from each other, it's hard to keep that communication going. So my question was, how would you do this as library and knowledge staff? How would you keep the communication flowing between the various members of the community? And we came up with some really good ideas. So we've got things, very traditional things like asking the group how they'd like to keep in contact, email lists, things that perhaps people are already familiar with, like telephone conferences, wikis, blogs, WebExes, that kind of technology and Skype. And then we've got social media, things like Facebook pages, Twitter, using Instagram, WhatsApp, and then things like Padlet, Slack, which we're looking at here for a particular group, and the good old conversations in corridors. So that's how you find out perhaps 2 or 3 groups of clinical staff are all trying to do the same thing, looking at the same procedure, struggling with the same problem, and bringing them together is going to help them to problem solve and to move the problem along. It doesn't always have to be a problem, but it could be an interest or another such thing that you want to set up a community for. Okay, and on this very subject of how to keep the community communicating with each other, if you go to the Knowledge for Healthcare blog, there is a case study about intranet chat rooms, which were set up in the Pennine Trust, and came out of a conversation with a healthcare professional who'd set up a group of people to meet on a semi-regular basis, but then they wanted to keep in touch in between the meetings. So they were able to set up intranet chat rooms and keep the communication flowing in that way. Okay, and then I asked if there were any other questions from our audience this morning, and one of the things was that how is a community of practice different to just networking and being in groups, meetings, forums, and it is that, I think it's twofold. It's that looking at a wider picture, so picking up through communicating with people, what issues they are all trying to improve. So, for example, we have they're setting up a leadership course within our trust, so that will be across a whole wide spectrum of staff, clinical, non-clinical, but their focus while they're on the leadership group and hopefully, while they're on the leadership course, and hopefully afterwards, is the skills of leadership, and that would be an excellent group to look at setting up a community of practice. So it's not just allowing people to go on the course, they do the course, and then going away individually and trying to implement what they learn on the leadership course. It's creating a way in which they can talk to each other both during and afterwards and maintain an interest in what they've learned on the course. Again, it doesn't have to come out of the course. It could be an issue or a procedure or anything like that. So community of practice is different from networks, although networking is a very good way of finding out what it would be good to set up a community of practice for. Okay, so as we know, knowledge management is a national subject now and something that we should all be working towards. And there is going to be a new national knowledge management community of practice set up. So if you would like to join the new group and contribute your ideas, you're asked to get in contact with your regional leads. So for us in the Southwest and Thames Valley and Wessex NHS libraries, that would be Sue Robertson. Okay, and thanks for listening. Next WebEx, knowledge management WebEx, will be on Monday morning, 9th of October at 10 a.m. and it's about sharing learning, and the tool that we'll be looking at from the Knowledge Management Toolkit is Retrospect. So thanks very much. I hope you found this useful, and thank you very much for listening.